of course, we have to, from a government point of view, they have to think about economic and social, psychological implications of the ongoing measures that we're using. And then the issue comes, at what point do we lift them to some extent, and to what extent? So it's quite possible that the measures might be lifted to some extent, and then as that happens, there might be a smattering of more cases. And of course, then we've got the uncertainty of what winter will mean in terms of this virus, in terms of whether there will be increased cases because it might prefer the colder weather. So there are all those uncertainties, and I think we will be reassessing things regularly.
Okay, I want to get to some questions to do with isolation. This has been the big theme of the week. There's been a bit of confusion around as well about what isolation means, what quarantining means, and what social distancing, or physical distancing as we like to call it now, means for people, depending on their circumstances too. So Sophie, I'll come to you with this one. This is a question we received off our website. How many people are allowed in a car? How many people can I invite over to my house?
Well, I think the authorities have been pretty clear about inviting people over, and the goal is really just to maintain the people who live in your house as the people you have contact with. So we really shouldn't be inviting anyone over other than the people who live there at the moment. I guess in terms of going out in the car, it should be the minimum number of people for the shortest possible distance. And again, only for those necessities like getting to work or going to the groceries to get groceries or going to a medical appointment. I think they were pretty specific, because I think people weren't getting the message. They were thinking, oh, I can't go out to a pub or a restaurant, but I'll have people over. And I think they were very clear in that messaging, and that having barbecues and having extended family gatherings, all the things that Australians love to do, we just can't do at the moment. And that's why you're seeing a lot more people doing virtual catch-ups as well, having, setting up a group chat on one of the streaming programs where you can all get together at a certain time and catch up that way, because the feelings of isolation that people have is very real. And so they're looking at sort of new and innovative ways that you can get that sense of connection that you would otherwise get in person.
Dr Senanayake, can I ask you this question from Heath Banyai off our Facebook channel? Do you need to keep a 1.5 metre distance from your spouse and kids, someone whom you live with?
Right, so in terms of isolation, and social distancing we're talking about, I think if you yourself haven't been told to isolate yourself because of an exposure to someone with COVID-19, and we're just practicing social distancing as a society, in one's house, I would just mix with one's family as one normally would. I think that is quite reasonable. Of course, if someone becomes unwell, whether it's COVID-19 or something else, then have an increased sense of practicing social distancing. But I think within the same household, it's probably reasonable to mix, and very hard to do otherwise, I would have thought.
Sophie, there is this question from our website. Is it safe to get cleaners, plumbers, builders, gardeners, those sorts of workers over to your house to perform tasks?
Yeah, look, that is a question that I don't think has been made perfectly clear. I guess you could look at how crucial is it that you have that person come to your house? Could they take precautions like gloves and masks and things like that? But I think you probably want to look at just how essential is it that they do the work that you're asking them to do. If it's something you could put off, if it's something you could do yourself, like cleaning, you're probably better off to do it yourself. If it's something like plumbing or something electrical you need fixing, it's probably safer not to do it yourself. But I guess it would be wise to just think about how important is it that you have that person come into your house at the moment.
Dr Senanayake, there are other tasks where it is difficult for a worker not to come into contact with a person who may be infected, not to say they are necessarily. So we think of people being transported from the airport back to their homes or into a quarantine station of some sort. This question again came through our website, Dr Senanayake. What happens to the person who transports people to quarantine, be it from airports or boats? For example, taxis, Uber drivers, bus drivers, do they need to go into quarantine as well?
So, Jeremy, if we're talking about quarantine, that's where we're separating and restricting the movement of people who've been exposed to a contagious disease to see if they become sick. So if they are not sick, they are not infectious. So that should not be an issue for the driver. In terms of driving or transporting someone who is sick, then that certainly can be an issue, and therefore there are strict protocols around that in the states and territories in terms of transporting a possible COVID-19 case who has symptoms.
We got a number of questions relating to how transmissible the disease is and whether it's airborne. Someone wrote to our website and asked, I live in an apartment, should I keep my front door and windows closed? The concern there, of course, is that the disease is airborne. To what degree is coronavirus airborne?
So it's transmitted by droplets. So COVID-19 is transmitted by droplet transmission. So if people sneeze or cough, the droplets containing the virus fall within about 1.5 meters of that person. And we can get infected by our hands getting on those droplets and then touching our mouth, nose, or eyes, or if we're directly at a very close distance coughed or sneezed into. Now, you can get it aerosolized or airborne, but that's only in the context of hospitalization and certain procedures. So I would not be worried about opening your windows in terms of getting coronavirus or COVID-19. Particularly if you've got a lot of people in the house, it might be a good idea to air it out.
What about walking past someone on the street?
So again, that should not be a problem. If that person's just breathing normally and you walk past them, not an issue at all.
And Jeremy, one of the things that I was reading this morning that was interesting, it was about, how long the virus can stay on surfaces, and particularly if people are taking their kids to the park or like a common area that might be used by, people other than yourselves, that it's better off not to be touching a lot of the surfaces there. So if you're going to the park, you're better off to, like, say, just take a ball and kick the ball with your kids rather than using the swings or equipment, unless you disinfect it first, because the fact that it can stay on surfaces for a while is obviously something that you need to bear in mind as well. So just, getting out and getting a bit of fresh air is a good thing as long as you keep your distance, but maybe just trying to limit the amount of times you're actually touching something.
Sorry, go ahead, Dr. Senanayake.
Yeah, sorry, Jeremy. I was just saying, and Sophie's perfectly right. And just to emphasize, even though it's a respiratory virus, it's really the contaminated hands that seem to be more of a concern than the breathing all over everyone.
We received this question from Ben Smith off our Facebook channel, and given the conversation we've just had, Dr. Senanayake, about the disease, to what degree it's airborne, Ben heard that the virus is airborne for 3 hours. Now, clearly that doesn't match up with what you've just said, but I don't mean to make an example of you, Ben, here, but this is really interesting because we all hear things from other people or from an online source of some sort, and it clouds the sort of judgment about what we should and shouldn't do. In this case, Ben has heard online that this virus is airborne for 3 hours, and it does really go to the heart of choosing your sources very carefully, doesn't it, Sophie?
Look, I can't really think of another example where there's been more misinformation about something as there has with this particular issue we're dealing with at the moment. I'm constantly being sent texts saying, oh, someone sent this to me, it's supposed to be it says it's from a very good reputable source, like I might name a hospital or a big organisation, an institution in the United States. But more often than not, the information is not correct. So you really need to be looking at going to those primary sources. So looking at, the World Health Organisation, the Australian government website, your health department website in each state and territory, the Centres for Disease Control, and dare I say it, the ABC. We've got very good resources as well. So that's where you need to be going, to getting good information so you can make good decisions based on the right sources, because a lot of the information that's being shared is just simply not true, and it's creating more confusion amongst people about what you should be doing.
Dr. Senanayake, your thoughts on reliable sources?
Oh, look, absolutely. I think Sophie again hit it on the head. With this particular query that Ben has come up with, I suspect he is actually referring to a reputable paper in the New England Journal of Medicine, where in the laboratory they aerosolized. So they did things to make the virus go into the air. And when it did go in the air, it sat around for about or hung around for about 2 or 3 hours. But again, that was just in the experimental situation where you're doing a procedure to make it go in the air. And as I said, those things would only be relevant to the hospital setting where you're doing certain procedures, not in the general community. And to add to what Sophie said, there are so many unreliable sources of information. I once, early in this outbreak, got an email from a journalist who asked me to review a paper. It had the name of 3 authors I didn't know, but one very eminent virologist. I read it. I was about to give my response. Then the journalist said, disregard it. The name of the virologist was falsified on that paper. So even we have to be careful.
And that's also another reason, Jeremy, also with our reporting of this issue, is that there's a lot of papers coming out, a lot of data, but we're being very careful to only report science that's actually had that peer review process, because a lot of the information that's coming out is very early, very small studies, and it's dangerous to extrapolate out those small studies to a big population. So we're being very cautious in the way we do report this issue.
Dr Sananayake, I want to go to a question that's been left on our Facebook page by Beth Stout a moment ago, picking up on this question of whether people such as taxi drivers, Uber drivers, bus drivers who are transporting people who've perhaps come back from overseas, who may be unwell, are not showing symptoms. There's not a great need, you were saying, for them to isolate because they've been involved in transporting and had close contact in a closed environment, in a vehicle, with someone who may be infected. At what point does a person become infectious? I mean, if they're not showing signs of the disease, does that mean they're not infectious?
So the definitions we're now using is that someone is potentially infectious a day before they get their symptoms. So if someone were to become sick, then public health would talk to them and look at all their close contacts in that period up to 1 day, or including 1 day before they got sick, and would regard them as a contact. But in terms of the whole issue of how infectious is someone when they don't have symptoms, we suspect, and certainly the head of the WHO mission to China, he felt that this being a major driver of transmission was very low. So people without symptoms weren't likely to be very infectious. But as Sophie said, we're getting more and more data every day, and that might change.
Alice Lee writes through us via our YouTube channel. Alice, thanks for your question. When will we go into a full lockdown? Now, the Prime Minister addressed this in his media conference this afternoon, saying he doesn't want people to use the language of lockdowns because it suggests something more catastrophic, more restrictive than maybe what is necessary. So he's kind of urging people to kind of steer away from this idea that we will all be locked indoors for an indefinite period of time. Is there a trigger, Dr Senanayake, of how these restrictions will be increased, and at what point, according to Alice's question, we will be compelled into a more restrictive environment?
Look, I must admit, I don't know the government's thoughts on that, but if we are continuing to see, as I was saying earlier, at that 3 or 4 week mark, no improvement in the curve, despite social distancing and all the measures that have been put in place being observed, then further strict measures may have to be brought in, such as the lockdown. But it is interesting to note that South Korea, who had an initial surge of cases in Daegu, their 4th largest city in the south, related to a particular group of people, they managed to get on top of that big surge without having to lock down any areas through the combination of having a number of test kits available, doing a lot of testing, and having excellent communication between the government and the people on a real-time basis using social media.
Sophie, any thoughts?
Yeah, it's interesting because I've really noticed in the last, I'd say 48 hours at least, that the tone, particularly from the Victorian Premier and the New South Wales Premier, was that they are prepared to move to that next phase that you have in the UK, in India, and in parts of the United States, where they are officially locked down and really even more restricted than we are at the moment. But I think it would be by a state-by-state basis, or even a region by region and area by area. I don't think we're going to see in Australia that full national lockdown, unless, like Professor says, unless we see that the measures that we're taking are not having the impact that they're hoping, that they're not flattening out that curve, and we're seeing a reduction in the number of new infections. So it's interesting though, because if you think about the way we're living our lives at the moment, we're really not that different from the other countries where they have imposed what they would call a lockdown. I mean, we need to be staying indoors. We need to be only going out when there's some urgent thing, or going to work if you can't work from home. So in a lot of ways, if people stick to the measures that have been brought in, it should make a big difference. And it's only if people decide to let their hair down a bit and not be as diligent that we'll see issues. And so we won't need to move to that next phase.
We've got a number of questions coming in from Jennifer Robinson, Deborah Jurek and Kay Lander, all of whom ask about face masks. Jennifer asked, what about the plethora of homemade face masks around right now? Kay Lander asks, are homemade face masks better than no mask at all? And Deborah says, do they work?
So if that one's for me, Jeremy, there was a study in 2013 where they took a group of people and gave one arm surgical masks and got the others to make a mask out of a cotton T-shirt, and then they got them to be coughed upon by various people. And they found that the people wearing the cotton T-shirt masks only would fit as well, maybe about 50% as well as those wearing the traditional surgical mask. And the surgical mask was 3 times more effective at stopping microorganisms than the T-shirt mask, but the T-shirt mask did stop microorganisms. So the short answer is, if you had to use a mask, you'd ideally use the more traditional mask, but if you had to use a bandana or a T-shirt mask, it would probably work to some extent.
Sophie?
And it probably also depends on why they're using it as well. I mean, I think the thing is that the authorities have been pretty clear saying that you don't really need to be walking around the street wearing a mask if you're not sick. If you're sick, you should be at home anyway. But the fact is that often people using masks can be taking away those masks from the healthcare workers and the carers who really need them. So the advice has certainly been on a broad level to not wear masks unless you are sick or caring for someone who is sick, because the amount of personal protective equipment, we're hearing in hospitals and GPs saying they're having trouble accessing what they need. So we want to make sure that the equipment is really there for the people who are at the front line of this crisis, the healthcare workers and the carers, and so making sure that there's enough supplies for them to get what they need, because they're the ones on the front line of fighting this.
Sophie, what about chefs and cooks? We've had this question before. Interested in your thoughts on whether chefs and cooks should be required to wear masks and gloves during food prep, and whether temperature kills this virus. That question from Jill Polly off Facebook.
I mean, I guess it's probably not a bad precaution, but the main thing is, with a mask, that is it going to be effective? Why are you using it? Are you using it because you're sick? And if that's the case, you really shouldn't be at work, or are you just using it so you're being protected from other people? So again, it really probably depends on why you're wearing it. I mean, gloves certainly would be useful. And then we've talked about heat before in terms of whether that makes a difference. And I think from our discussions last week, we were saying it can make a bit of a difference, but not that much of a difference.
Dr Senanayake, the question of masks in food prep and the role of heat in killing the disease. Your thoughts?
No, I agree with Sophie as well. If someone isn't sick, they shouldn't have to wear a mask. But in terms of hand washing, I think regular hand washing, which is good anyway and probably entrenched into food handlers and chefs, should continue to be practiced. In terms of temperature and the coronaviruses as a group are what we call thermolabile, which means they are susceptible to heat, and temperatures of about 70 degrees will kill them.
Okay, so this question then comes from Danielle Golovanoff-Wood of our Facebook channel. Should we be washing fruit and veg in warm soapy water or disinfecting that fruit and veg when we received delivered groceries, because the virus has proven to survive on surfaces? And as we know, in supermarkets, people are they're touching these fruit and veg before you pick them up and put them in your trolley. Dr Senanayake, what's the view there?
Yeah, I mean, there's the assumption, of course, that there is COVID-19, the SARS-CoV-2 virus on the fruit, and that's a big assumption. But if it is there, giving it a thorough wash should be more than adequate.
With soap?
Well, no, I don't think you need to have soap. I think you just give it a thorough wash and a rub. That should be fine.
Sophie,
and then I guess if you were worried, there's also the option of like peeling, for vegetables and things like that. And, there are some products that you can get which are designed to take off, pesticides and things that you can wash fruit and vegetables in, and they would probably be a good idea as well. But I guess even as a basic thing, just to rinse the fruit and vegetables first, and then I would probably do that and peel the vegetables just to be on the safe side. But I mean, it goes basically the hand washing thing is just so important that if you're washing your hands and washing, the fruit even just with hot water, that's going to make a difference. And I think the more we can get into the habit of that people sometimes try to complicate the issue and think we need these disinfectants and we need all these other things, but just the hot soapy water for your hands and for surfaces and things like that can actually make a really big difference.
And if you really want, Jeremy, if you really want to, sorry to interrupt. Just if you really want to, you can leave it for 2 or 3 days.
Because that's the time in which it takes the virus to guarantee to die out, doesn't it?
Yeah, exactly.
Okay. Now, I want to come to this question about testing, because there's been some uncertainty and anxiety about how the criteria works, and it's certainly changed, Dr Senanayake, in the past week. Jan Armstrong asked this question: what about those who've been in medical isolation because of flu-like symptoms but don't meet the criteria in order to get a medical clearance? They won't know whether they're positive or negative and whether they're still carrying the virus in their system even after they start feeling better. How has this changed over the past couple of weeks, the regime for qualifying for testing?
Oh, look, the case definitions for testing are changing all the time. And certainly from a hospital point of view, we have a much lower threshold for testing people who've got a fever or respiratory symptoms, particularly if they're healthcare workers or they're coming from the aged care sector. There's more discretion for GPs to test people in the community. But it is worth remembering that still the majority of cases we've seen so far in Australia, even though we've seen the cases climb, have largely been associated with outside sources of infection, be it a cruise ship or overseas travel. And that, particularly in certain parts of the country, there's hardly any community spread at the moment.
Yeah, that's right. I think the statistics were today. I think that they were saying at least two-thirds of the cases are still from people who travel from overseas. And there's only, I think in New South Wales, they announced some of the statistics today that there's about just over 100 cases where they can't track back to where those people might have got it from. But the vast majority are from people who have come back from overseas. But it's interesting, and that's probably why you've seen the government put the stricter quarantine measures in place that they've just announced today, because we have been seeing some stories of people who have returned from overseas and who are not sticking to the 2 weeks quarantine that they have to isolate themselves. And so I think that's something to keep in mind. There's also there also is some discretion as well that, like you mentioned, that general practitioners do have if they are concerned about a case and they don't meet the exact criteria. There's a little bit of discretion that they have to offer a test, but there wouldn't be enough tests. Even if we ordered a whole lot of more tests, there wouldn't be enough to test everyone who probably would like to be tested, and that's something to bear in mind as well. I guess the other thing is looking at how long someone's been sick for. If that woman that's written in has been in isolation or quarantined herself for 2 weeks, then even whether she has it or not, she's past that period anyway, when she'd be able to go back into the community after that anyway.
There's been a few questions about testing kits, the availability of testing kits, whether home testing kits are on the horizon. Kriya Coleman asks, what's involved in the process for making the test kits and why does it take so long? Sophie?
Well, I don't know whether you want a DIY test kit. I don't think that's on the agenda, but generally the test kit will be a swab either from your nose or throat, and then they have to go. The reason it takes a while is because they need to put it through a process where they look for the the DNA of the virus. So it's not a simple blood test or as easy as some other potential tests. But there are some quicker tests that are coming. There's a test that can be done in about 15 minutes that's going to be brought into Australia. So that should speed up the process. But at the moment, because you do have to go through that more complicated way of testing, that's why it's taken a bit longer. There's also been some delays in getting results back. So, you know, it was supposed to be 24 hours, but we've definitely spoken to both patients and doctors who've said it's taken up to a week sometimes to get those results back. So hopefully with the more tests that are coming out, that turnaround time will be quicker.
Dr Senanayake, have you had to turn people away, you know, sort of suggest why they might, tell them why they might not be getting tested? How do you explain that to someone who may be feeling sick, may have the anxiety about having caught COVID-19, but probably hasn't got it? How do you explain that to a patient?
Sure, and look, this is being done all over the country in walk-in centres and other testing centres and in clinics. And look, we just try and give them the evidence and reassure them that this particular category of people are the ones who are at risk of COVID-19, and you do not meet that criteria. There are lots of other respiratory infections that are around every year that could mimic what you have, or another illness that could explain what you have, and we don't need to test you at the moment. And for all the reasons that Sophie mentioned as well, we've got a limited, although we've got a lot of tests, there's a limited number of tests, and they have to be processed through the laboratory, which can take a lot of time. And if we do more and more tests that we don't need to do, that just extends that time for results even further.
Dr Senanayake, what do we know about the people who've recovered? What are the rates like, and what percentage of people have shown enough antibodies to indicate they have immunity now? That question from Jasmine Adams.
Sure. So in terms of antibodies, we're just getting the antibody tests now. So that's telling us, that will be able to tell us in terms of large numbers how people have responded to this infection. About 1 or 2 weeks ago from Melbourne, I think it was the Doherty Institute, a group of researchers demonstrated in someone who had mild COVID-19 infection that they had a robust response in their immune system with different parts of it, including antibody responses. So they produced an IgM antibody and an IgG, which is an early antibody and a later antibody. And that would be consistent with what we see with other coronavirus infections and other viral infections. So we think most people must be producing antibodies, and that's the basis of some of these rapid tests that Sophie touched on. They'll be testing antibody tests, antibody presence, to see if you've been infected with COVID-19.
And Jeremy, that paper was really interesting as well, because understanding how the body can fight coronavirus will give the people who are developing the vaccines around the world a much better understanding of what the vaccine would need to do to prevent people getting this virus. So that was a really interesting insight into just how the body can fight it off. And that was in a patient with very mild to moderate symptoms, but that patient, that woman, was able to mount a really good response. Her body was able to fight the virus and get better in a relatively quick amount of time and without any long-term side effects. So it was actually a really good insight into how the body can respond to this, and hopefully it will help speed along the process of finding a vaccine in the future.
Mary Richards asks this question on the Facebook live stream. Mary is asking, can you get it twice? Sophie.
Well, that's something that we still don't really know. We actually did a story on that where we interviewed Peter Doherty himself, the Nobel Prize winner, and he thought it would be unlikely, with the research and the science we've got at this stage, that it would be unlikely that you could get it twice. But I would have to say that it's still difficult to say 100% that that's the case. But based on his understanding, would be that it would be unlikely. So he's probably the expert that we would go to ask that question, and he said it would be unlikely. But Professor, what do you think? What's your thoughts on that?
Yeah, thanks, Sophie. I also agree with Professor Doherty about that, and we just talked about the study which showed that people develop antibodies, and we know with other coronaviruses that you seem to get immunity for at least 2 or 3 years. So at least in the short term, one wouldn't expect a COVID-19 case to get it again. Now, there has been some data coming out of China where they've sent people home after they've had 2 negative tests, where they've done swabs of the nose and didn't detect the virus, and have followed them up at home and then found that they're positive again for the virus. But again, these people haven't infected anyone in the household, they haven't been sick, and rather than reinfection, it probably is just this intermittent shedding of virus, which may be dead, that we might often see with other viral infections.
And just to pick up on a question that Barry Smith has asked on the live stream on Facebook, why is it taking so long to figure out whether people can get it twice or not? I'll just quickly answer this one, Barry. It's because the science isn't fully conclusive yet. We're still learning about this very, very new virus. Sophie, I want to come to a question that we received through our website for you. For the people who are infected and in hospital, is the government covering the cost of treatment? Is it covered under private health insurance, or do we have to pay out of pocket?
That's a very good question. I would imagine that the majority of people who have this and who are being looked after in hospital, it would all be under the public hospital setting. So I know that they've made some announcements in the last couple of days about private hospitals and elective surgery to free up the private hospitals. But the majority, if not all of the patients who have this, who would either be in isolation in hospital or being treated in hospital, would be in the public hospital system, and that would be covered by Medicare. When we look at the rates, though, it's important to remember that the majority of Australians who've got this virus have actually not ended up in hospital, and only a small number have ended up in intensive care. So often when we do these comparisons, looking at the number of cases in Australia compared to, say, the number of cases in Italy, we are dealing with people here who are much less sicker than other parts of the world, and much fewer of them are in ICU at the moment. So that's actually a good thing. And as I said, the majority, if not all of them, would be in a public hospital.
Dr Senanayake, Melanie Davies asked this question a couple of times on our Facebook feed. We weren't getting to it. Melanie, thank you for writing in. What happens, she anticipates, when thousands of people perhaps don't consent to this vaccine whenever it does come out in the next 12 to 18 months? Do you foresee that as a problem?
Well, yeah, it's an interesting question. We probably won't get that vaccine for 12 to 18 months. So the issue of COVID-19 may have been resolved naturally. It's hard to know. But if it's still an ongoing issue, if you look at what we call the R0, or the reproduction number of this virus, how many people a person with COVID-19 infects, we probably need about 60 or 70% of the population immunized to protect those people in the population who haven't been infected or immunized. So if those figures are correct, then even if a small number of people refuse to have the vaccine, then it still may be okay.
And then I would imagine when there is a vaccine too, Jeremy, that the health authorities would really want to target the most vulnerable populations to get that vaccine. So there would be talking about people who are aged over 65, people who've got existing chronic health conditions such as high blood pressure, obesity, diabetes. So in a lot of ways, if you were targeting the vaccine to those more vulnerable populations and making sure that there was a really good coverage with those people, that would probably be where they would target their initiatives in the start. But ideally, the more people you could get to have the vaccine, the better immunity you would get across the whole society.
Now, this question from Elijah Bennett off our YouTube channel. Elijah asks, perhaps a very uplifting question. As average Australians, is there anything we can and should be doing to assist our brave frontline medical workers who are anticipating, Dr Senanayake, a bit of an increase and a stretch in resources in the coming weeks?
Oh, that's a lovely question. Thank you for it. The best thing would be, as we've seen in other parts around the world and this week as well on social media and ABC television, the message of healthcare workers saying, stay at home, observe social distancing. That will really help us make a difference. One reason I think we're not necessarily seeing young people observe social distancing is we have been saying that 80% of these infections are mild, but it is worth remembering that when I talk about something being mild, I'm saying you probably won't end up in hospital. You still get a pretty awful illness for 2 weeks where you have fevers, horrible body aches, and feel really tired. You don't want to have that as a young person. And we know from the Chinese data that of those people who died, the vast majority were older, but 6% included those aged 20 to 50. So why take a risk? So thank you for the question, and observe social distancing, stay at home.
Sophie, it strikes me that death is perhaps the wrong measure to be thinking about this crisis, that a lot of people may not die but get very gravely ill.
Seeing the people who've recovered from this illness coming out and talking about just how bad it was, even though, like the professor said, it was only seen as a mild to moderate illness, so they weren't in hospital, but they did feel very, very ill. And that's something that you wouldn't want anyone of any age to get. And we're also seeing in New South Wales, at least, there's been quite a few cases in children. So even though they don't end up as sick as some older adults, you still don't want kids to get this either. So, you know, there's been some great messages on social media from medical staff and health workers where they've posted photos of themselves saying, stay at home. I can't stay at home. You know, stay at home because you can, but I can't. So that's the best thing we can all do, is to stay at home and do our bit. And the more people that do that, the easier it will be for the healthcare workers to do their really important job of keeping everyone safe.
And with any luck, we'll see that curve start to flatten in the next couple of weeks. Dr Sanjaya, Sophie Scott, terrific to have you both on this live stream along with our viewers. Thank you for sending your many thousands of questions in to us this week. You can, of course, stay up to date with the latest information on the special coverage page of the ABC News website. That's at abc.net.au/coronavirus. Very easy to remember. Thank you for joining us. We'll be back live here with another live stream next week. And keep those questions coming from all of us. Bye for now.